Ladies and gentlemen, Congressman Mark Kirk, representative of the 10th District of Illinois.
In 1999, a Washington-based consultant wrote a study recommending the closure of our VA hospital. The study said that Lake County veterans could get help in downtown Chicago or Maywood or even the Milwaukee area. A decade ago, some of you met with me over at the Full Moon restaurant next door, just west of here, and we made a solemn promise, not on our watch. And today we have made good on that promise. This new facility, you bet. This new facility will care for more than 100,000 veterans, retirees, sailors, and their families. And it's my hope that this becomes a model to improve veterans' health care throughout the nation. And what a better way to honor our veterans than naming the facility after one of our nation's heroes, 10th Congressional District resident and Apollo 13 commander, Captain James A. Lovell, Jr. Now, in 2007, I wrote to Deputy Secretary of Defense Gordon England and requested that the new facility have a name and reflected its pioneering mission of medical care. By the way, as one wag said behind us as we were coming out here, if they had named a ship after you, it would have only lasted 30 years, but a hospital is forever. In his response, Secretary England said, "It's fitting to name the facility after Captain Lovell, not only for the reasons cited in your letter, but also in the history-making Gemini 7 mission, which included the first rendezvous of 2 manned maneuverable spacecraft. The joint DoD-VA healthcare facility in North Chicago can be described as the first rendezvous of 2 separate medical treatment facilities, joining them into one, a cohesive, comprehensive federal facility, a history-making event in itself. This event is the byproduct of countless individuals' work, and the list of those who joined us here today is too long to read, but I want to highlight a few people who worked tirelessly on behalf of our veterans. Johnny Allen, can you stand? Johnny in the back, thank you very much. If you know Lake County veterans, you know Johnny Allen and how he inspired us to make this all happen. I also want to thank Al Pate, who is Patrick Sullivan's predecessor, who first met with me in secret and then in public to make this the policy of the administration. I particularly want to thank the men who really made this happen. First of all, Captain McGew, and especially Patrick Sullivan. Patrick and Captain McGew, thank you very much. I want to also thank one veteran who could not join us here today, Phil Mazer. Phil was the chair of the VA Stakeholders Advisory Council and was with us on this project from the very beginning. A Navy man, he knew the importance of taking care of our own. Sadly, Phil passed away on August 21st of this year, just weeks before he could have seen the completion of what we worked 10 years to accomplish. This hospital is for Phil and for countless others who have come before him, and for the future generation of Americans, especially the ones that will wear the uniform of the United States Navy. We owe a debt to all men and women who sacrifice for our nation. This hospital is another step in taking care of those who take care of us. And if I might say, my last term as a congressman for this hospital, without a doubt, this is one of our greatest achievements. I am proud that Lake County finally has a hospital that veterans deserve. One last thing. I want to thank my staff member, my right hand on this, that worked on this from the beginning, Patrick Magnuson, who many people know here today, who helped make this happen. God bless you. God bless your family. God bless the United States Navy and Marine Corps. And God bless the United States of America. Thank you.